Welcome to this dental health video. Physical health and oral health go hand in hand, promoting overall well-being, especially for people living with HIV. Oral health symptoms for this population can indicate a decline in immune function. Oral health problems can make it difficult to chew or swallow, impacting nutritional status or the ability to take HIV medications, which are key factors in maintaining overall health. As a dental professional, you can help your patients who are living with HIV achieve their oral health and overall health goals.
We want to talk about flossing today and assist you with the technique for flossing. We're going to take a piece of floss that is approximately the width of your chest, so that'll be enough, and that's about 18 inches. We want to then pull it between our fingers and pinch it and wrap it so that we're getting an area that's about like this, so we can go between the teeth. Then I'm going to pull it down in between the teeth and rub up the side of the tooth. And essentially what we're doing is trying to make a C curve around the side of the tooth. We're going to pull this taut and push forward to clean this side of the tooth using a C forward, and come out, go back down, come in between the teeth, and to see this side of the tooth.
When working at dental offices, it is very important to give your patients the best care and information possible to help them keep their mouths healthy and clean. Staying informed will allow you to give your patients the best information, promoting a strong patient-provider relationship. Check in with all of your patients about their concerns and their general well-being. It is important to remind your patients that you are available for questions or concerns. Assure them that if something doesn't feel right, it is okay to give them a call or visit the office. Ensuring a confidential environment is your responsibility as a dental provider. State and federal laws such as HIPAA require that HIV status and other medical information be protected. If you show patients that confidentiality is important to you, patients will be more likely to share their medical history with you. As with all patients, a comprehensive medical history is necessary for a complete understanding of individual medical and dental needs. Many people living with HIV are self-sustaining in terms of managing their own HIV healthcare needs, while others may have the assistance of a case manager. Case managers provide support with housing, insurance, transportation, and coordinating medical or dental appointments. They can also be a resource for obtaining pertinent medical information. Another important resource is your patient's HIV medical care provider. This may be their primary care physician, or they may see an infectious disease specialist. Having access to your patient's comprehensive health history ensures your ability to provide a higher quality of care. It also allows you to tailor your treatment to meet their specific needs. It is important to get a complete list of their medications. This will prepare you for any potential drug interactions or side effects and to determine any special concerns their healthcare provider may have. An intra-extra oral exam is an important initial step in dental treatment. There are numerous oral health conditions that can occur in all patients, including those with HIV. Since the advent of HAART, highly active antiretroviral therapy, patients are living longer, healthier lives with fewer symptoms. Not all people living with HIV will experience the following oral health conditions. However, these conditions can impact their susceptibility to pain and infection, nutrition, and adherence to medication. Xerostomia is defined as dry mouth resulting from reduced or absent saliva flow. It is a major contributing factor in dental decay. Approximately 30 to 40% of HIV-infected individuals experience moderate to severe dry mouth in association with the effects of their medications. Dry mouth is a major cause of gum disease and tooth loss in 3 out of every 10 adults. If left untreated, xerostomia decreases the oral pH and significantly increases the development of plaque and dental caries. Fluoride treatments are necessary to help prevent rapid decay. There are products available to manage severe xerostomia. It is important to be aware of what is available to give your patients symptomatic relief. Encourage your patients to sip water or sugarless drinks often. Avoid drinks with caffeine, such as coffee, teas, and some sodas. Caffeine can dry out the mouth. Sip water or a sugarless drink during meals. This will make chewing and swallowing easier and may also improve the taste of food. Chew sugarless gum or suck on sugarless hard candy to stimulate saliva flow. Citrus, cinnamon, or mint-flavored candies are good choices. Not to use tobacco or alcohol, as they can dry out the mouth. Be aware that spicy or salty foods may cause pain in a dry mouth. Use a humidifier at night. Periodontal disease, also known as gum disease, is an infection that attacks the bone and gums that support the teeth. People living with HIV are more at risk to periodontal disease and may face more severe and rapid forms of this disease. This can include linear gingivitis, erythema, and necrotizing ulcerative periodontitis. Necrotizing periodontitis is characterized by the rapid destruction of soft tissue in the mouth and is an indication of severe immune suppression. The condition is characterized by severe pain, loosening of teeth, bleeding, fetid odor, ulcerated gingival papilla, and rapid loss of bone and soft tissue. Patients often refer to the pain as deep jaw pain. Candidiasis, commonly referred to as thrush, is an infection caused by yeast on the skin and on mucous membranes. When the infection occurs in the mouth, it is called thrush. Thrush is caused by a fungus named Candida albicans, which grows out of control and causes painful lesions, usually on the inner cheeks and tongue, but can also spread to the roof of the mouth, gums, tonsils, and throat. Symptoms can include fissuring of the corners of the mouth, whiteness of the tongue, and white patches on the cheeks that are not easily scraped off. It can persist for an extensive period of time if left untreated. Oral hairy leukoplakia, which is caused by Epstein-Barr virus, presents as white, corrugated lesions along the sides of the tongue and cannot be wiped away. This condition is normally asymptomatic and does not require therapy unless there are cosmetic concerns. However, it is important to note that the condition is observed with immune deterioration and that patients presenting with it while on antiretroviral therapy may be thus experiencing failure of their current regimen. Herpes. In most cases, oral herpes causes lesions in the mouth and lips that are commonly referred to as cold sores or fever blisters. Symptoms include painful blisters on the lips or under the nose that ulcerate and crust over and are fairly easy to recognize. Oral ulcers that present on keratinized tissues, such as the roof of the mouth, are usually herpetic. Human papillomavirus. The most common forms of the virus produce warts on the hands, arms, legs, and other areas of the skin. The wart-like growths are called condyloma tissues. Condyloma tissue appears like a small cauliflower-type growth on the skin and may be spiked or raised with a flat surface. These growths are usually painless but can cause some irritation, itching, or burning. It can be treated whenever it flares up and is non-malignant. Most HPVs of this type are very common, harmless, non-cancerous, and easily treatable. Kaposi sarcoma is a cancerous tumor of connective tissue and is often associated with HIV. It is caused by an interaction between HIV, a weakened immune system, and the human herpes virus number 8. The tumors appear as bluish red or purple sores or lesions on the skin. Early lesions tend to be flat, red, and asymptomatic, with the color becoming darker as the lesion ages. Diagnosis is frequently missed in African American patients due to lesion coloration. Oral cancer is a type of head and neck cancer that affects the mouth. It can form in the lining of the cheeks, gums, roof of the mouth, tongue, and lips, and is more common in the users of tobacco products than in non-users. The patient may complain of a mouth sore that fails to heal or that bleeds easily, or a persistent white or red or mixed patch. The patient may note a lump, a thickening or soreness in the mouth, throat, or tongue, difficulty chewing or swallowing food, difficulty moving the jaw or tongue, chronic hoarseness, numbness of the tongue or other areas of the mouth, or a swelling of the jaw causing dentures to fit poorly or become uncomfortable. Not all people living with HIV will experience these conditions, but for those that do, detection and treatment will help minimize the impact on the patient's life. It's important to document changes in the condition of your patient's mouth and advise them of what to look for. Instruct your patients on how to perform a self-oral exam. Knowing what to do and what to look for helps your patients to monitor their own health status.
We're going to be looking in the mirror for any changes on the lips. We're going to sort of pinch our way along here. So would you like to use your finger and try that out?
Okay.
Yeah. All right. And now if you'll just take this finger and pull back the cheek. Okay, and try to look in the mirror, open really big, and try to direct the light to see if there are any changes inside. And you can also take this finger here and come along like that, so you are feeling for changes.
Since the advent of HAART, highly active antiretroviral therapy, patients are living longer, healthier lives with fewer symptoms. Xerostomia remains a serious problem even in the HAART era. The standard precautions you use with all your patients are the same for working with clients with HIV, and no additional precautions are necessary. The current standards of practice protect both you and your patient.
The universal precautions that you use with all patients are used with the HIV positive patient. We wear protective lenses, gloves, mask, and a gown for all treatment. When we're using an ultrasonic, we use a shield, and for rotary instruments, we also use this shield. The current standards of practice are in place to protect both you and your patient.
If you have questions or concerns about standard precautions, there are many resources available. www.osap.org may be a good place to start. Lab results are a vital source of information. Labs are typically drawn every 3 to 6 months.
The CD4 count is an indicator of the strength of the immune system. The higher the CD4 count, the stronger the immune system, and a CD4 count less than 200 is considered to be AIDS. As the CD4 count falls, people are at risk for more and more infections and cancers that are associated with HIV disease.
Patients with an undetectable and low viral load are on an effective drug regimen. Knowing the patient's white blood cell count and absolute neutrophil count are important, as an absolute neutrophil count less than 500 cells per microliter requires the patient to be pre-medicated prior to invasive dental procedures. The platelet count is as important, as dental procedures can only be safely performed with a platelet count of 50,000 microliters or greater. The HIVdent.org website is a comprehensive resource for further information on this topic. Providing treatment to people living with HIV is no different than treating any patient. You need a comprehensive medical exam, an individualized treatment plan. Contact us if you have any further questions. Thanks.